ncc.edu with widow interview in the subject line. That email address again is whpc@ncc.edu.
Winner of the Best Artist or Celebrity Interview Award from the 2019 Intercollegiate Broadcasting System. The station where celebrities love to talk.
FM,
HD,
Amazon Echo, Google Home,
The TuneIn Radio app,
the iHeartRadio app,
and nccradio.org.
This is 90.3 WHPC.
WHPC HD. Garden City,
Long Island,
New York.
Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Dr. Janine Cook-Garrard from the Nursing Department here at Nassau Community College, along with my co-host, Nassau Community College student Joseph Torino. And today we're talking about health benefits of acupuncture. Today's show may be the sharpest show we've ever have done in a while, and we'll even be doing a demonstration on the radio. So I know it sounds crazy, but I'm excited to hear and learn all about this and actually see the demonstration. Our guest today is Nan Gilbert, a licensed New York acupuncturist with certification in Chinese herbology. She has over 16 years experience in traditional Chinese medicine. And Nan brought along with one of her patients. Now her patient is going to be the nursing student, and who has agreed, right, Joseph?
Yes, I did. I'm quite excited.
To actually be the patient and get some treatment right now over and during this interview. We'll be getting acupuncture. So, Nan, welcome to Your Family's Health, the voice of Nassau Community College, 90.3 WHPC. How are you today?
Jenny,
Yeah.
Joseph, how are you? Good morning.
Good morning.
I'm so excited to come to here.
Great. So let's start from the basics, Nan. What is acupuncture?
Acupuncture is all the points on your body, and we open use acupuncture to open your blockage to make you new person. And 100% natural and zero side effects. My side effects are going to make you more energy, happier, and pain release.
Mm-hmm. And with these techniques, are there different types of acupuncture treatments or different needles, for example?
Of course.
We're looking at some of these needles, kind of scary.
Don't worry about it.
Okay.
As here, and you don't feel that much if you have a good needle technique. So when it gets inserted in your skin, you don't feel that much. I have a license in New York, 22 years, experience acupuncture. Needle technique. Definitely not going to hurt you.
So, Nan, how did you start? So this practice of acupuncture started before you came to New York. How early did you start with this technique?
Oh, very interesting. I was pianist in China, but never think about it. I can use acupuncture as my job. But I get training from my grandmother. She's a famous acupuncturist in China. And she training me for fun, special for diagnosis. I just gave a diagnosis to Joseph and Jenny. And I have to look at their tongues and take your pulse to give your whole body diagnosis. Mm-hmm. And my grandmother would tell me, when the patient walk in, after you look the patient's whole body picture and the tongue and the pulse, you tell patient 70% diagnosis before patient open their mouth. That's good doctor.
So what kind of ailments can acupuncture help with? What kind of things can you see?
Usually stress. is a big problem
Stress.
for United States. I can say this.
I have to agree with that.
A lot of people have problem definitely caused by bottom line from stress. Like they come in, they can tell me the problems, right? The neck pain, shoulder pain, sleep problem, and I don't like this. It's like leaves. I cut the leaves away, and that they ask me what's happened with you don't ask my symptom, you just give them treatment. I say, you tell me so many. I'm not looking for the leaves problem. I'm looking for your root. What's the reason to causing you to have the insomnia, diabetes, and you go to bathroom at nighttime, or your face color different, or low energy, or shoulder neck pain, high cholesterol. So that's a root problem. Some root maybe lack of pH, maybe lack of water, maybe too much water, or lack of a balance, too much pH, too much, too low. That's part I'm looking for that to treat you. After I treat your root, you're short of you lack of water, I give more water. You're too much water, I adding more soil. So after I treat your root, you're gonna have a new sprouts, new leaves come out from a brand new soil.
So you get to the root of the problem. Now, how do you diagnose individuals? What do you look at?
Okay, Jenna, that's a good question. That's from many years experience.
So you was able to diagnose me by looking at my tongue.
You're smart. You're asking me the key question. Okay, your tongue. Everyone come in. Before they talk, I will say, show me your tongue, or show me your belly button, your shape of belly button. Give me questions. Give me answers. What's wrong with your body? What's wrong with your which part, which channel I'm gonna focus on that. So, Jenna, so let me talk to you a little bit acupuncture. Probably a lot of people never heard that. Very natural, organic, 200% organic, and 1 year we have how many months?
12 months in a year.
12 months.
Oh, that was
okay. 1 year for 12 months. So our body, we have 12 channels.
Okay.
Running. The one channel finish, you go to turn to another channel, and over. That's your body supposed to run as ocean. If one channel stuck, your body start to have problem. So sometimes you do exercise, or I can teach you we have meditation class free. I always teach your patient which points you're patting yourself. You can massage yourself to open that channel. After open the channel, the energy goes through the channel, connect to next channel. You come to my office, whatever, I'm not treating you. I just open your channel. That's what's channel problem. That's I'm training to opening that your body go back nature, work as ocean.
You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Jolene Brighten from the nursing department here at Nassau Community College, along with my student co-host, Joseph Torino. And today, we're talking to Nan Gilbert, a licensed New York acupuncturist with certification in Chinese herbology, with over 16 years of experience in traditional Chinese medicine. And we're here, and we're going to do a special acupuncture treatment today. So you're talking about when a person comes in, you open up the 12 channels. And so once those 12 channels, this is one treatment, or is this a series of treatment to open up the channels?
Another good question. You're very smart, Jenny. And sometime only one treatment.
Okay.
And sometimes it's few treatments because our body, we're not robot, we're human beings. So I cannot diagnose this by phone or tell you, okay, you're going to feel, I can from my experience about how many treatments you need. But sometimes there's only one treatment done. And yesterday I have a patient walk in and she sent her daughter to me. I say, I didn't know you. She told me I came here half years ago. Only one treatment. You stopped my neck pain. So now I bring my daughter back. So, I tell her you need 3 treatments. Finally, only one solved her problem. So everybody different. Some people need 10 or a package. Everybody different.
So, I'm sorry.
Go ahead, Joseph.
So can you treat most health issues with these treatments that you offer?
I try my best.
Okay. Well, and which ones?
Okay. Weight loss, high blood pressure, high cholesterol, stress, even facial release, facial rejuvenation, and I have a big subject for infertility. I have my office, most patients for infertility, husband, wife come in. I've been helping so much mother to natural pregnant to get a beautiful baby. You can come to my office. I have so many babies pictures, cute, beautiful.
So I need to stay away from your office then.
You're still young, Jeanette.
Okay. So how about addictions? What has been your experience with addictions? Have you been successful in treating addictions like alcohol addiction, drug addiction?
A lot.
Okay.
And also for that part, you really have to, you need it, you want to get treatment. Yeah. Also, our office, we have a 2,000 square feet. Another big part is for free meditation. It's not just, Chinese East treatments have 3 levels. First base level is acupuncture, like a triangle, pyramid acupuncture. Second level is a less people, herbologist. Third level is the top, only points like this triangle, energy healer. And now we go back acupuncture. We have 1 year. How many days a year? 3,065 days a year.
365, yes.
Right. So our body have 365 points. 1 year, we have 12 months. We have 12 channels on the body, all by nature. How does the Asian Chinese find the channel and the points? Very interesting. And through the meditation. So whatever you go to any school, Western school, the material average, they change every 4 years, change material. But when you go to Chinese acupuncture school, never ever change material. We keep the charts, the material for 2,000 years, never change until today. You go to acupuncture school, we still use same exactly points from 2,000 years. Why it's not change? Because true of universe, you don't have to change. The channel change, same thing, points, same thing. So I have a lot of patients, go back to the question Jenny gave to me, for stress. If acupuncture combined with a meditation and herbs, the very good result.
Very good
100% natural and 0 side effects.
So, Nan, can you tell me as to your thought about combining Chinese medicine then with Western medicine, where you're giving medications, patients are given medications. How does that work in combination? Do you suggest that patients stay on their medications that were prescribed by the doctor in addition to doing the acupuncture?
Jenny, you gave me tough questions. Okay, answer you. A lot most patients come to me because for insurance purpose, most of the patients come to me. That's the last choice before they get surgery or before very bad situation they come to me. They already take so many pills. First, I have to work on liver channel and kidney channel because so much side effects from a liver. You take so much pills, you give a side effect to your liver and kidney. So whatever your liver, whatever your kidney feel, kidney is like a filter for your body, detox your body. Liver, same as the liver. If your kidney liver is no energy, is less energy to detox your body, it's definitely you're sick. So number one, I have to clean up your kidney and liver. Use the acupuncture. How I do that? I'm not giving more job for your liver kidney. I use the acupuncture to give energy for your liver channel, kidney channel. I wake them up. I pat in your liver kidney channel. Hi, baby, wake up. You need to work. I know you are very tired. I want you poison out of body and opening.
Let's take a quick break, Dan. Thank you. My name is Jolene Brighten from the nursing department here at Nassau Community College, along with my student, Joseph Torino. And today we're talking to Nan Gilbert, a licensed New York acupuncturist with certification in Chinese herbology with over 16 years experience in traditional Chinese medicine. You are listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.
This message is for all of you sitting in the passenger seat. And apologies if it gets a little uncomfortable, but how does it feel to be at the mercy of someone who thinks a random text is more important than your life? Someone who takes their eyes off the road while speeding along in a 3-ton hunk of steel. Freaky, right? Well, why not just ask them to stop? Or better yet, volunteer to text for them. It might be a little awkward, but believe me, you'll live.
Learn more at stoptextstoprex.org. Brought to you by the Ad Council and the National Highway Traffic Safety Administration.
We now return to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.
Thank you for being with us today. This is Dr. Jolene Brighten from the nursing department here at Nassau Community College. And I'm here along with my student co-host, Joseph Torino. And today we're talking to Nan Gilbert, a licensed New York acupuncturist with the certification in Chinese herbology with over 16 years. Now I'm hearing 22 years experience in Chinese traditional medicine. And we're here and we're going to find out about acupuncture treatment because we're going to do it live here now with our nursing student who has so nicely agreed to be a patient. So, Nan, take it away. Let's see this process.
Okay, Jenny, we're going to start it. Joseph?
Yes. So,
okay.
Joseph, you're going to tell us as we're doing the procedure, tell us, your feeling and give us some subjective as to how it's going.
Okay, let me give you diagnosis. Open your mouth and let me see your tongue. Okay, let me take your pulse. How's your neck?
My neck is a bit stressed.
How's your knee?
The knee is a bit painful.
That's painful. Joseph's tongue and the pulse. And also I do palpitation. He complains he's a right knee pain. So I'm going to start the treatment. So first I use alcohol to clean his face. That's very interesting. We treat channel by channel, not exactly the place he has a problem, like he has a knee problem or a neck problem. I'm going to use the points on his face or his head.
So it doesn't have to be at the point of the pain.
Exactly.
It can be a different. So your whole point is to get to the channel.
Right.
Oh wow! You put it. Okay. So you just inserted a needle near his ear.
Yes.
And how does that feel, Joseph?
Fine. There's no pain associated with it.
Do you have pain here?
No.
I touch?
Yeah. Oh, right there.
That's your lower back.
Oh.
A lot of knee pain course from a lower back, so I have to start lower back all the way down.
Wow, he actually has needles sticking out of his
your knees,
jaw. Wow.
Touch?
Yes.
Okay.
Yes.
Yes.
Now stand up.
Sure.
Try your knee. Move your neck.
Oh, wow.
You feel better already?
Yeah, actually.
Okay.
That's what happened a lot from my clinic. Right away, right a moment, the pain go away.
Boy, I'm jealous. I need some needles stuck in.
No problem. You come to my office.
Right. Okay,
Yeah.
so now you have. So how long do the needles stay in place?
Sometime in and out, or sometime 40 minutes, 30 minutes.
How do you know how long it's supposed to stay?
Usually I keep them 40 minutes.
40 minutes?
Yes. I do a lot of volunteer work, so in and out. But staying 40 minutes is better result.
So is there ever anything injected into the skin at all, or is just a needle insertion?
Only needle.
Only needle.
Yeah,
What is
needle.
the whole point of the needle? Could it be, of the insertion of the needle? What is the principle behind that needle?
Needle. Open the blockage.
Just open the blockage.
Yeah. I'm not treating you. I just open whatever you have a channel, which channel. Sit down, Joseph. Thank you very much. And whatever you have, I diagnose you to find out your problem, your channel, and your points. A channel. I looking for the channel and find the key points for this channel. Acupuncture points. That's how to work. To release your whatever your pain, your stress, diabetes, or infertility. I have a lot of infertility patients.
So now for your infertility patients, the needles that you just inserted in, Joseph, do they stay in to keep the channel open? Like if you insert the needle, is there a means to keep the needle there to keep that channel open and flowing, or is that not necessary?
You're right. Keep that open.
Okay, so you keep it there.
Different points depend on which problem do you have. So everyone's different. Joseph, he's young, so I use a needle very small and very, very thin already work. If for the age little more, so maybe a little longer needle, but you don't feel that much. For infertility, I'm going to put some points to open for uterus channel. So if a lot of patients come to me, they have a menstruation problem. After you solve the menstruation problem, the headache will go away, and energy is a big difference, because if your uterus problem, there's lack of your female hormone. So if you open the female hormone, your whole body, you change the new person.
You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Jolene Brighten from the nursing department here at Nassau Community College, along with my student co-host and patient, Joseph Torino. And today we're talking to Nan Gilbert, a licensed New York acupuncturist with certification in Chinese herbology, with over 22 years in traditional Chinese medicine. So, Nan, this is very interesting. So, Joseph, how do you feel? You feel better?
Yeah, I actually feel better. I was not expecting it to be that sudden.
Okay.
Yeah.
And how many needles do you have now? You actually see the needle sticking out of your head.
Yeah, I can see the ones sticking out of my head. I don't know how many are there. Okay. But I don't feel them.
It looks like 4 in your face. And
no. The needles are very, very thin. You don't feel them. And also the very important needle technique, how you put in the needle. Needle technique is from experience.
And you didn't feel that?
No.
So Nan, have you ever done, this is acupuncture. How do you combine that with acupressure? Or do you do acupressure?
I know how to do that, but I'm always too busy. I don't have time.
Okay.
I have a sticker. I can teach you how to do that. That's just for my free meditation class. Okay. I teach my students how to use your hand or some even your spoon and olive oil to massage yourself, to maintain your balance and to treat yourself, and also preventive. That can help you preventive treatment. My grandmother would tell me when we were young, one story, 2 acupuncturists, 2 doctors, and the younger brother's patient tell him, "You're good. After your treatment, I feel better." And the doctor said, the younger brother said, no, I'm not good. My older brother better than me. He said, why? Because my older brother's patient, they're never sick. That's a preventive treatment. My grandmother lived to 108. No sick, just meditation, sleep, go away. Never sick. And very healthy. And also, Chinese secret. And she took chew the garlic every night, raw garlic, and vinegar every night, and exercise, meditation every single morning. Every morning, keep her to live 108, healthy, and also happy. Always have a smile on her face. I miss her so much.
So what is the requirement to become licensed? And do you think licensure for acupuncturists is different in China in comparison to here in the States? Do you think it's the same qualifications or curriculum? Or
in China, you have to take more class than here. And also, you definitely must take herbs. And American, you don't have to take herbs. If you want to be a herbologist, just take a few courses, and it's much easier in China. So we have so many, with 100 acupuncture schools in the United States. Soon, I think acupuncture is American, just same good as China, because different. Americans really like acupuncture now. I can't, I see the difference. I've been have a license for 22 years. 22 years compared now is a big difference. A lot of people, they already get acupuncture treatment, and they believe that acupuncture, natural healing, can help their body with zero side effect. So, more patients looking for acupuncturists. So, definitely, as more students go to acupuncture school.
Yes,
I'm so happy to see that.
So how can we get in contact with you? How do we find you?
You can go to my office.
Do you have an office?
Yeah, my office, America Road, North Belmore, and also my phone number's right here. Nina Healing Art Center. You search Nina Healing Art Center.
So let me read your card. It's called the Healing Art Center, and it says acupuncture, herbology, and energy healing, and it's 2579 Merrick Road in Belmore. Okay, and your website is NinaHealing.com. Okay, so this is where you are, and the telephone number is 516-442-7408. So
thank you, Janet.
Yeah, so we wanted to let you know that you are there and you are doing wonderful with this acupuncture that you do and provide for people.
Also, please check our website. I'm looking for my review, Yelp and Google, so you understand what's the result from my treatment.
Okay, so I just want to thank you for being here with us today. And just to let you know,
thank you,
Nan Gilbert, a licensed New York acupuncturist with certification in Chinese herbology with over 22 years of experience in traditional Chinese medicine, along with my student and patient, Joseph Torino. Let's just keep those needles in, Joe. So when you come to class, the nursing program, you can think clearer.
They're waking me up. My knee feels amazing. I'm really...
So this is Dr. Jolene Brighten, and again, from the nursing department here at Nassau Community College. And thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the nursing department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.
The views expressed on air are not necessarily those of WHPC, its management, or Nassau Community College. Responsible opposing viewpoints will be considered by emailing them to whpc@ncc.edu or by mail at WHPC 1 Education Drive, Garden City, New York 11530. Thanks for listening to the voice of Nassau Community College, 90.3 WHPC.
Welcome to Herbally Yours, an adventure into the world of natural medicine. Here is your host, Dr. Ellen Kamai, the natural nurse who will help you take the leap to ultimate wellness.
And greetings. Thank you so much for joining me. This is Ellen Kamai, the natural nurse, and we are here today for another edition of Herbally Yours, right here on the voice of Nassau Community College, 90.3 WHPC. Herbally Yours brings you the latest information about the many facets in the world of natural health, natural living, and all kinds of topics related to that. And we're so happy to be here today with our guest. And our guest today is Dr. Jolene Brighten. And before earning her doctorate of naturopathic medicine at National University, which is one of the premier universities for naturopathic medicine, she graduated with a degree in nutritional biochemistry and clinical nutrition. There, she was involved in nutrition research, exploring interventions for maintaining healthy hormones and body composition as we age. She is currently the medical director at Rubus Health in Portland, Oregon. Dr. Brighten's postdoctorate education and training in functional medicine and clinical nutrition is through the Institute for Functional Medicine, and we've had many guests on from there, including the person who started all of that, Dr. Jeffrey Bland. She continues to study with IFM to stay up to date on the most innovative therapies and techniques to help patients heal. Dr. Brighten's first book, Healing Your Body Naturally After Childbirth, The New Mom's Guide to Navigating the Fourth Trimester, was an instant bestseller and helped hundreds or probably thousands of women to heal themselves after birth. And today we're going to discuss her new book, Beyond the Pill. To find Dr. Brighten, it's easy. It's Dr. Brighten, Brighten, drbrighten.com. So thank you so much for joining us today, Dr. Brighten, on Herbally Yours.
Hi there. Thanks so much for having me.
Now, let's go back in time a little bit and share with me why you wanted to become a naturopathic physician after completing your biochemistry and clinical nutrition studies.
Oh, well, I was actually going to go a different route altogether, and I was at the time studying for my master's in nutrition, and I was engaged in research, and I actually had a full scholarship to go to UC Davis and pursue my PhD. And it was during that time that I came to realize I had a whole lot of science, but what I really was lacking was this respect for the healing potential of the body and a philosophy that looked at why from a different perspective and a much deeper level. And so I think I do love me some science. It helps answer a lot of questions, but I think there's some places where it actually falls short in terms of really asking why on the individual level someone's experiencing something. And, since childhood, I've had a fascination with herbal medicine, using food as medicine. And so it was, as soon as I found it, I was like, this is what I was really meant to do. This is such a natural transition. I just had never heard about naturopathic medicine, growing up in a small town in the country.
That's a good point. In fact, I'm teaching a class called Career Paths in Natural Health and many courses in herbal medicine. And in the career paths, we talk about naturopathic medicine because I really believe if someone has the time, energy, and high level of science, because you need that to even apply, that is the best and most comprehensive training in natural medicine.
Yeah. And, in a lot of ways, I think people, they think, oh, well, you're a naturopathic doctor, therefore you only use natural remedies. And what they don't recognize is that we are studying and learning herbal medicine, nutritional medicine, and pharmacology all at the same time. So we can really understand that, there is a time and a place for pharmaceuticals and medical interventions. And if you need that, how can we support your body? And I like to say, we look at, if you're ever going to put a patient on a medication, what's the plan for getting them off, which is, a lot different than a lot of the ways drugs are prescribed today, which is like, here's your pill and go on your merry way. It's going to fix everything. But we really marry both sides of the natural medicine world and the conventional medicine world to help patients navigate that space in between and help them understand what's going to be the best next step for them.
Yes, and you know what? That prioritization is so important from a naturopathic's perspective. I would say the only part of naturopathic medicine that I find, challenging is the fact that it is not fully recognized as a licensed professional in every state, although it is in many states.
Yeah, and it's a very interesting thing, in terms of the politics of how things work with getting licensure. And a lot of it is because there are people who identify as naturopaths. They're not licensed clinicians. They have not, done the rigorous coursework, and they don't have a governing body, which in a lot of ways, as long as they stay in their scope, it doesn't necessarily translate to something dangerous. But there are people who are, they identify as naturopaths. They don't want to see the licensure of naturopathic physicians because, in a way, that would then mandate that they can't use that term because it would be practicing medicine without a license. But it's a very interesting thing when you look at all of the different medical professionals that are out there. I know registered dietitians are up against this as well, that they're not licensed and recognized in every state. Although, they have the training, they go through residency, and it's so interesting to me the way that this works on a state basis.
That's true, and I think we could be more politically active. But certainly where you are, in Oregon, as well as on the East Coast, I'll say Connecticut, fully licensed naturopathic physicians, and sometimes they have hospital privileges. Certainly you are the best trained and most knowledgeable person to discuss your topic, healing your body naturally after childbirth, or your new book as well.
Yeah, well, and a lot of that, that I pulled from is from my naturopathic background, but it also comes through, the hours and hours, I should really say years, that I've spent on PubMed and going through the research. And then what I really have married, the science with my clinical experience in listening to my patients, holding the space for them to be able to tell their stories. And this is something that, has really afforded me, an interesting perspective in writing Beyond the Pill, is that I come from a heavy science background. And so with that, having done research, able to, when I started to see the pattern of what women are experiencing with birth control side effects and, what I term post-birth control syndrome, that is the collection of signs and symptoms that arise when you stop hormonal birth control. So when I saw that, I right away went into documenting and then starting to refine protocols. And I just have to thank my patients for being with me on that ride and recording their data and reporting back to me so that I could fine-tune these protocols to a place where, eventually they were put into books so this medicine can get into every woman's hands. And the story of I'm crazy or it's in my head can really stop. Like, that's really one of the goals of this book, is for women to know their body so well and to really trust the symptoms, that their body is providing them information that can help guide them in how to care for their body and really feel their best.
So I'd like to remind you that you are listening to Herbally Yours on the voice of Nassau Community College, 90.3 WHPC. I'm Ellen Kamai, the natural nurse, and my guest today is Dr. Jolene Brighten, and we're talking about her brand new book, which is really about birth control pills and just birth control in general. So we're very, very happy to have her on. The name of her book is Beyond the Pill, a 30-day plan to support women on birth control, help them transition off. So, Dr. Brighten, let's talk about that. certainly, and maybe you agree, perhaps you don't, having a child when you don't want one is probably a pretty intense adverse effect in your life when we're balancing what to do about that.
Oh, absolutely. I think, an unintended pregnancy is a very difficult decision for a woman to face. And no matter what route she goes, there's an emotional burden that goes along with that. And so, that's something whenever people will say, oh, well, Dr. Brighten, she wrote a book, detailing the side effects of birth control and showing women that, there's other ways to balance your hormones besides birth control. That's why it's called Beyond the Pill. I'm going to go root cause with you and give you solutions beyond birth control. But with that, people will say, well, you must be anti-birth control. And I have to confess, I used the pill for 10 years. It was a tool for me to be able to become a first-generation college student. I became a doctor. I was able to control my reproductive health. I would never advocate for women to have that taken away from them. But at the same time, they deserve to have the full story. They deserve to have all the information they need so at the end of the day, they can feel confident that they made the best decision for themselves, whether that's to use hormonal birth control for contraceptive reasons, or if you're in the almost 60% of women who are using it primarily for symptom management. This is 100% your choice. But you should also have the information to make that choice and know how to stay safe while you're on it. And, to your point, there's an entire chapter. So chapter 13 takes women through non-hormonal contraceptive options so you can weigh your options. And step one for every woman, if they're thinking about coming off of hormonal birth control, is get a backup method. Figure out a way to prevent pregnancy that's going to work for you.
Those are really, really good suggestions. Now, one thing I will often suggest for those clients who actually are on birth control pills, one of the symptoms, as we know, are psychological symptoms. And very often that seems to be linked to the depletion of B vitamins, which we always know that most drugs cause a depletion or a lack of availability or production in the body of various kinds of nutrients. So, sometimes a simple thing like increasing B vitamin high foods and perhaps using a good quality supplement before you go on an antidepressant because you're depressed, really it's kind of an adverse effect of your birth control pills.
And there's an entire chapter in Beyond the Pill talking about mood-related side effects, depression, anxiety. Sometimes it's, PMS, mood swings that, has a doctor reaching for their prescription pad to give women birth control. And so I come at it both ways of, if you're thinking about starting birth control for mood symptoms, here are some things to consider instead. If you're currently struggling with mood symptoms wherever you're at, here's some, acute remedies because, anxiety, depression, those are really can keep us from walking, from cooking, from doing the day-to-day things that we know can really move the needle in health. And at the same time, I explain, what is this mechanism of action? It's a hypothesis right now from where we're at in the research of how is birth control related to these adverse mood symptoms that we have. And there was a study that came out of over 1 million women showing that if you're prescribed birth control, you're 23% more likely to be prescribed an antidepressant.
That's right.
Part of that is because of nutrient depletions. Yeah, so B vitamins, so B6 is a big one, magnesium as well. That can impact how you make serotonin. But we also understand now that hormonal birth control is inflammatory. There's a marker called C-reactive protein that is elevated when we start hormonal birth control. And one research study actually looked at what does hormonal birth control do in the female brain. It causes it to make neurotoxins rather than making neuroprotective molecules. So we've got nutrient depletions, inflammation, and neurotoxins. Any one of those things could cause you to feel depressed or have anxiety or start having mood swings. And then I go even deeper in the book, talking about how it impacts your adrenals, your thyroid, and your gut. Any one of those systems being out of balance can lead to mood symptoms as well.
But at the same time, you're about perhaps non-hormonal alternatives if you're using birth control pills, particularly for birth control.
Yeah, and that's, something that I think is a really exciting part of 2019 is that last year we saw the FDA approve the first ever femtech device as a contraceptive. So this is the Natural Cycles. It's a thermometer, and it's based on the fertility awareness method. I still think if you're going to use the tech, also meet with an educator, a FAM educator, who can help you with this. But we're starting to recognize, and I don't know about you, but, long ago, I got the story that you had to use hormonal birth control. That was the most effective way to prevent pregnancy. However, we now know that the pill is only about 91% effective with typical use. That is, 9 out of 100 women will get pregnant while they're using it. It's only with perfect use that we get that 99%. That's taken at the same time every day. You've got great absorption rates. I mean, that's not every woman out there. Whereas fertility awareness method, leveraging these femtech devices, like Natural Cycles and Daisy's another one, these have been shown to be 99% effective with preventing pregnancy. And that's
great, and they're non-toxic. Old word for that, since I'm old, I'm going to throw out the old word, is similar to what we used to call the rhythm method.
Yeah. And, with FAM, it goes a little bit, a little more sciencey in that you're getting your basal body temperature. And I think marrying that with your symptoms of do you see fertile cervical mucus? Are you having an uptick in your libido? Meeting with an educator that can help you with cervical position, you can really dial in. And what I found is that with my patients, if they use FAM, they don't take a back seat to their reproductive health. Whereas, when I was on the pill, I'm like, I'm taking a pill. I don't need to think about this. It'll be fine. And in reality, there's a lot of women who have reported getting pregnant on hormonal birth control. Now, remember, if you're using fertility awareness method,
wait, one second, doctor. Okay. We have to take a little break here, and then we will continue our discussion. So, listeners, I'd like you to know that you are listening to Herbally Yours on the voice of Nassau Community College, 90.3 WHPC. Listen live online at nccradio.org. or on iHeartRadio. For more information on today's guest or topic, email whpc@ncc.edu. Stay tuned. Herbally Yours will be right back.
We first opened about 10 years ago. We were small, just a few of us, but it was exciting. I always dreamt of having my own business. It was kind of slow at first, but things started picking up. We had big plans, but in our wildest dreams, we never thought we'd have this much work. Yeah, with so many businesses caught off guard by the storm, Reed Waste Management has never been busier.
What will become of your business after a disaster? Nearly 2/3 of businesses aren't prepared for an emergency, and 40% of businesses that experience a disaster never recover. Make an emergency plan now, before it's too late. For a free online tool that helps you develop an emergency plan to keep your business up and running should disaster strike, visit ready.gov/business. Brought to you by the Federal Emergency Management Agency, the American Red Cross, and the Ad Council.
And welcome back to more right here on Herbally Yours. Thank you so much for joining us on the voice of Nassau Community College, 90.3 WHPC. This is Ellen Kamai, the natural nurse, and my guest today is Dr. Jolene Brighten, who is a board-certified naturopathic physician and also has degrees in, is working with functional medicine, clinical nutrition, and biochemistry, so she knows what she's talking about. And we are discussing her new book, Beyond the Pill. Fascinating information for really everyone, because if you're not a woman who's still having her cycle, you know one. So you can bring this up to them so they can find out more. Now, Dr. Jolene, I'm interested in something that you are involved with, which I don't know much about, but I bet the women who are childbearing age mostly do, and that's a data-driven app to offer women personalized birth control recommendations. What is that?
Yeah, so the app is called Ask Tia, and it's really exciting because they built this app, and they're also launching a clinic in New York City to have women get access to gynecological care that's much more holistic and meets the woman's needs rather than, you know, what medicine has dictated women should have in a gyne exam. Now, the app, you can plug in your data. It will track your symptoms, and it's a situation where if you get an IUD, if you start the pill, you know, whatever route you choose to go, if you start having side effects or symptoms, the app's going to let you know it's time to go check in with your doctor. Like, things were going well. Now you started this birth control, and you're starting to have side effects. It's time to have a conversation with your doctor. And then it also guides women through. So, for example, if you say, I have heavy, painful periods, the app's going to let you know that a copper IUD isn't going to be the best option for you, and really serves to educate women so they're more informed when they have a discussion with their doctor.
Now, what is the name of that? Could you spell it for our audience?
ASK, Ask, Tia, T-I-A.
Oh, that's funny, because Tia is aunt in Spanish. So,
yeah,
kind of, you know, like ask your aunt, which I'll tell you, many people who are of Latina origin certainly do ask their aunts about things because their aunts are knowledgeable, and that way they don't have to ask their mama. So that's a really great name. I'm wondering about the development of that name. Maybe I'll find out one day. But it's Ask Tia. Is there a website, asktia.com?
Yes, it is.
We'll have to look into that. That sounds really useful, and thank you for your work in helping to develop that. Now, what about the cancer risk of taking birth control pills? What should women know about that?
Well, you know, when we look at the cancer risk, in my clinical practice, we always want to view it through the lens of, like, what is this individual's risk factors as is before we add in birth control to the mix? Because, you know, although there are studies that will say, oh, well, it's a mild increased risk in some of these cancers, we have to view it through the lens of, like, well, what else is going on in this woman's life that might make it one more drop in the bucket to push her through towards that? So with the pill specifically, we know there's an increase in breast, cervical, liver, and brain cancer. But on the flip side, there's also a reduction in ovarian and endometrial cancer, which, you know, some docs will say you have a family history of ovarian cancer, and let's put you on the pill. And for a long time, we always thought it was the estrogen, the synthetic estrogen in birth control that was raising the cancer risk. But as we've come to understand through the research, progestins, that is the synthetic progesterone, they play a role in increasing breast cancer as well. So for women who are on the pill, I want you to understand that we got told for a long time that the newer pills were lower hormones, and because of that, they had a lower risk of breast cancer. However, a study came out and showed that that was never correct. And so, on average, about 55 women per year are likely to receive the diagnosis of breast cancer per 100,000. And when you start the pill, that rises to 68. So 68 women per 100,000 are looking at the diagnosis of breast cancer. So researchers have concluded this is a mild increased risk. But understand, we're talking about cancer. And so you have to weigh, is this a risk you're comfortable taking?
So one of the big things, you know, that I've seen people use that for also are skin conditions like acne.
Mm-hmm. Yeah, acne is a super common reason. I mean, over 10% of women report using birth control to manage their skin. And it can work well for acne. However, it doesn't address the root cause of acne, which is often gut dysbiosis, inflammation, nutrient depletions. And hormonal birth control can lead to all those things. It can change your microbiome. It can induce intestinal hyperpermeability. It depletes things like zinc and vitamin A, which are essential for your skin. And when you come off of it, you can have what's called an androgen rebound. That is, your testosterone rebounds and comes back online in a big way, causing oily skin, acne, and even hair loss.
So it has to do with sort of an imbalance or jacking up of the testosterone ratio.
That can be one reason, yeah, where women experience cystic acne or acne in general as part of post-birth control syndrome. When you're on the pill, it shuts down ovarian production of testosterone by as much as 50% and then raises binding proteins that grab onto that testosterone. When you stop, those binding proteins don't drop, but the ovaries can then start producing testosterone again. And it's just kind of like they get really excited. They get to make testosterone finally. And that can lead to issues with our skin, our hair, and then certainly, mood changes as well.
So, it's so complex. It just seems from a naturopathic's perspective, and someone like you who is studying so many different aspects of the issue, that it's just not such, an easy breezy thing. And I'd like to remind you that you are listening to Herbally Yours on the voice of Nassau Community College, 90.3 I'm Ellen Kamai, the natural nurse, and our guest today is Dr. Jolene Brighten, Brighten, and she certainly is bright, so aptly named. And you can find her at her website, which is drdrbrighten.com. Is that the best place for people to find you after today's show?
But yeah, you can find me at drbrighten.com. I also hang out on Instagram at Dr. Jolene Brighten. And then for people who prefer to learn via video, I have a YouTube channel as well. So we all learn differently, whatever works for you, but drbrighten.com is my main hub.
And it's so wonderful with your naturopathic perspective and your biochemical knowledge and moving forward into, functional medicine. I mean, it brings it all together, but what a different aspect than a medical doctor conventionally trained who only has one thing to give you, a prescription. And they don't even seem to take into account all these lifestyle issues that someone like yourself does.
Mm-hmm. And I think conventional medicine is great for the purpose that they serve. There is a place for everybody in medicine. And certainly, if I get in a car accident, those are the people I want to see. But when it comes to this root cause medicine that works with the body and respects the symptoms, not as something to strong arm into submission, but to actually learn from so that you can help that patient really address the underlying issues, that's where naturopathic medicine thrives.
Well, let me ask you this. Sometimes women are afraid to come off the pill because there does seem to be a lot of side effects. What do you advise with that?
Oh, yes. So in my book, I take you through the Brighten protocol, which will help you avoid post-birth control syndrome and help you, feel safe while you're on it and actually stay safe, but also transition off when you're ready. And the biggest thing is that we've got to get the foundation really taken care of, which is diet and lifestyle. So within my book, you'll find recipes, you'll find a meal plan. I take you through a quiz that's identifying your hormone imbalance. And so in that way, you can pinpoint, how should I eat? How should I be moving my body and, living day to day to really manage these hormonal symptoms? Those hormonal symptoms are really dictating what your body needs and how you can serve it. And so I take you through all of that. I also provide supplement guidance should you choose to go that route as well. But I'd like to remind people you cannot out-supplement a poor diet and lifestyle. So that is always your foundation and your starting place. Something as simple as starting to bring in, broccoli sprouts, doing seed cycling, which is a way of cycling seeds to work with your menstrual cycle, and even leveraging herbal medicine can help a lot of women avoid the symptoms of post-birth control syndrome.
What did you say, seed cycling, like SEED?
Seed cycling. Yeah. So
I never heard of that.
Yeah, so this is something, the interesting thing is that when you're learning gynecology, if you're in your first year at naturopathic medical school, they start talking to you about seed cycling, which is eating certain seeds within your menstrual cycle. So break it down really quick. Day 1 is the first day you see your period, so you have blood. That's day 1 through 14. We're going to eat fresh ground flax seeds and pumpkin seeds. These are going to be raw, so you get the oils. And then we're going to switch following, ovulation. Maybe that's day 14 for you, maybe it's day 10. But following ovulation, you switch, and now you have fresh ground raw sesame seeds and sunflower seeds as a way of working with your menstrual cycle and providing the nutrients and the fats that you need to build estrogen in the first half of the cycle and build progesterone in the second half of your cycle.
Wow, that is fascinating and so all natural. I love it. So we actually are out of time. I want to thank you so much for being our guest. talking about her new book, Beyond the Pill, and you can see that it's very rich and in-depth with natural ways that you can cruise through basically various kinds of hormone cycles, and you can find out more at drbrighten.com. To thank you for listening. That to Herbally Yours, produced in the studios of 90.3 WHPC, Nassau Community College, Garden City, New York. For further information, email us at whpc@ncc.edu. This is your host, Ellen Kamai, the Natural Nurse, at naturalnurse.com, inviting you to join us next week for another edition of Herbally Yours. Until then, stay healthy.
The views expressed on air are not necessarily those of WHPC, its management, or Nassau Community College. Responsible opposing viewpoints will be considered by emailing them to whpc@ncc.edu or by mail at WHPC 1 Education Drive, Garden City, New York 11530. Thanks for listening to the voice of Nassau Community College, 90.3 WHPC.
This show is brought to you by the NYCB Theater at Westbury, who presents Vicki Lawrence and Mama, a two-woman show on Sunday, April 7th at 8 p.m. More information can be found online at the theater at westbury.com.
You're listening